Hello, my name is Dr. Carmen Burke. I am a family holistic dentist practicing in Boulder, Colorado. Today I want to answer some questions that I have every day in my practice, and is what is better, to get an implant to replace a tooth or a bridge? Our patients are always asking me why should I choose this or the other one, so I want to explain some facts that are really important at the time of making the decision. One of the things about replacing with an implant is that when we place the implant, it keeps the bone for the adjacent teeth. That's really good. When you have a bridge, you don't replace that missing tooth, so the bone starts reabsorbing. Since the alveolar bone, which is the bone that is around the teeth, the only function that it has is to be around a tooth. So once you miss a tooth, the brain gives the order of those cells that eat the bone to go and just remodel that bone. So that can affect the adjacent teeth. So that's one of the advantages to get an implant. Another thing is the cost. So a lot of people ask me, oh, it's more expensive, or where is it? So the price is similar when we talk about money, but I always tell my patients that, money you can get, but teeth you can't once you drill them out. So the thing is that when we do a bridge, we have to drill the adjacent teeth in order to place the bridge, because we need to make them smaller enough for the crown to be good in the alignment of the arch. The issue is every time that we drill, we affect the vitality of those teeth. Even if you have crowns, we can remove the crowns, but then we expose the dentin and the vitality can be affected. So we want to keep the teeth that you have vital as long as possible, because otherwise they can be affected. And then you will need a root canal or an extraction, so you don't want to risk for one tooth the other adjacent teeth. The other thing is that we, in our practice, we use Ceramic-zirconia implants. There are CeraRoot is one piece implant. It's very biocompatible, so it's really good for health, and is one tooth problem, one tooth solution. So the adjacent are not affected. Actually, it could be really good because it protects the bone that is around the adjacent teeth. Yeah, those are the main reasons where one of the other option. I hope it's clear. If you have any other question, please let us know. Thank you so much.